One of the common questions I get asked from patients is whether TMS is similar to ECT. The short answer to that is no, although both do utilize the healing powers of electricity. ECT, known as electroconvulsive therapy, pejoratively known as shock therapy, has been around for a long time, over 80 years. 1938, two Italian physicians, Bini and Cerletti, discovered that if you ran a direct current across the brain to the point that the patient is having a seizure, is an effective way of treating very severe cases of depression. It's generally done in the hospital under general anesthesia in a series of 6 to 12 treatments, generally 2 to 3 times a week. And it works, very good treatment, but very invasive. Again, the patient has to go into the hospital. Many times after the completion of treatment, patients will come back and they may still have some cognitive fuzziness or cloudiness. They may complain of some memory loss. They may even have, some issues with things like word finding. In TMS treatment, it's a lot different. We're not running a direct current. We're using electromagnetic fields to target very specific parts of the brain. In the case of depression, which is the FDA-approved protocol, we're looking at the left dorsolateral prefrontal cortex. We're putting the coil right over that part of the brain. We're not stimulating the entirety of the brain. And what we're doing in TMS is we're taking bundles of neurons, we're getting them to discharge thousands of times. In the case of the FDA-approved protocol, it's 3,000 stimulations in 20 minutes. It's like a workout for that part of the brain. But again, we're not hitting the whole brain. And what we see, actually, if that's done in a series of 30 treatments with a 6-session taper, we see that generally not only do the patients feel better and their depression hopefully improves, it's actually good for memory, again, unlike ECT. So we've had, as an example, patients with mild cognitive impairment come through. We've had a couple of patients with traumatic brain injury, and we've tested pre and post via neurocognitive testing. We've actually seen some neurocognitive gains on those assessments, not just improvement in mood. Our patients can drive to and from their appointments. Again, TMS is very non-invasive. It's done in an outpatient setting. It's not done inpatient in the hospital. Sessions usually last 20 to 30 minutes. And the patient comes in, they get their treatment, they're able to go back to their day, go back to work, or to their daily activities, and generally feel better. Most of our patients actually like the treatments, and we'll talk about how they actually even feel better directly after the treatments.